Take our lead. Let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
Together, Leigh syndrome and MELAS are the most common mitochondrial myopathies. The prognosis of Leigh syndrome is generally poor, with survival generally being a matter of months after disease onset.
Make your mark. Take our lead.
Adult-onset mitochondrial disease often presents in more subtle ways. The disease may manifest for the first time in adulthood or may be first recognized in adulthood after a history of symptoms dating back to childhood. Adult-onset mitochondrial disease is typically a progressive multisystem disorder.
Take our lead.
They include biochemical tests on urine, blood and spinal fluid, a muscle biopsy to examine the mitochondria and test enzyme levels, magnetic resonance imaging (MRI) of the brain and spine. Testing depends on symptoms, and may include echocardiogram, electrocardiogram (EKG), eye examinations, hearing tests.
Take our lead.
Another subcategory is mitochondrial myopathies, a group of neuromuscular diseases caused by damage to the mitochondria, with some examples including Kearns-Sayre syndrome (KSS), Leigh's syndrome, mitochondrial depletion syndrome (MDS), mitochondrial encephalomyopathy, lactic acidosis and stroke-like episodes (MELAS).
Make your mark. Take our lead.
Mitochondrial disease diagnosis every 30 minutes. A child is born who will develop a mitochondrial disorder by age 10. Overall, approximately 1 in every 4,300 individuals in the United States has a mitochondrial disease.
Make your mark. Take our lead.
Parkinson's disease (PD) is a complex neurodegenerative disorder, the etiology of which is still largely unknown. Overwhelming evidence indicates that mitochondrial dysfunction is a central factor in PD pathophysiology.
Take our lead.
A small study in children with mitochondrial disease examined the patient records of 221 children with mitochondrial disease. Of these, 14% died 3 to 9 years after diagnosis. 5 patients lived less than 3 years, and 3 patients lived longer than 9 years.
Make your mark. Take our lead.
Additional, non-genetic tests also help in diagnosing mitochondrial disorders. They include biochemical tests on urine, blood and spinal fluid, a muscle biopsy to examine the mitochondria and test enzyme levels.
Thank you for watching. Please subscribe and hit the bell notification.